Growing up, my family was filled with a whole bunch of daredevils, which is partially why I've been riding motorcycles since the age of 3. And through all this, I've had my fair share of falling, scraped elbows and knees, and the occasional head on collision with a shed. Yes, I rode my motorcycle into a shed, but like my dad says, if you ain't falling, you ain't riding. But seriously, through all of this, I've always had some sort of way to manage the aches and pains I have, whether it be going to the doctors or getting some Advil. And I really couldn't imagine having this sort of access, which is why it shocked me to learn that citizens in Ecuador don't have the same quality access to healthcare that we do here in the United States. So my mom used to take these yearly trips to Ecuador where she and a group of people would go and set up clinics in rural parts of Ecuador to provide healthcare services to communities that normally wouldn't have this sort of access and medical care. And she used to explain to me that although Ecuador is an established country in South America, the challenging terrain creates many issues when it comes to these people accessing healthcare. So the main reasons, again, are geographical, and this is partly because Ecuador straddles the Andes Mountains and also occupies part of the Amazon basin, and this creates really challenging terrain to move around on. So after hearing all these stories and seeing photos and whatnot, I realized that the citizens in Ecuador have a limited access to quality healthcare, and the main reasons are human and infrastructural challenges, systematic inequalities, as well as financial limitations. So first I want to give you some background information on Ecuador's current healthcare system. It's a two-sector system, and you have a public and private sector. Now this public sector has a national health system that allows any citizen, regardless of income, to receive free healthcare, which is great if you live in one of the three main cities of Guayaquil, Quito, or Cuenca, because the doctors are in those three main cities and you have good access and good quality healthcare there. One thing to know is that doctors in Ecuador must do a 1-year rule posting in Ecuador to obtain their professional licensing. So sometimes people in rural parts of Ecuador have a limited access, but still access to healthcare. So the first real big issue I want to introduce you to is geographical challenges in Ecuador. So according to macro trends in 2019, the rural population of Ecuador was about 6.2 million, which is roughly 36% of the population. This means 64% of the population lives in one of those three main cities, and they have good quality access to healthcare. But another error, human error, limitations, and challenges is what I want to talk about next. So according to Expat, in 2011, there was about 1.7 doctors for every 1,000 persons in Ecuador, compared to the United States, which has about 5.5 doctors for every 1,000 people. Another crazy issue in healthcare is that Ecuadorian doctors are known for failing to respond to emergencies, simply because they don't want to be assigned a patient. And the last human error is, according to Loreno Carlo and Valerio Carpio, two professors in Ecuador, in 2019 they said that 35% of their patients speak Quechua. However, 96% of the doctors and nurses do not speak this language, and about 28% of those are illiterate. This creates a really challenging time for doctors and patients to communicate. So next I want to talk about infrastructural challenges that the healthcare system faces. So the first one is there's a lack of coordination and interoperability. Then there is difficulties understanding the health messages and prescriptions being provided. And there are also barriers to following the treatment plans and following through. So next, I want to gradually discuss the systematic inequalities that affect access to quality healthcare. So according to Mr. Lopez Ceballos in 2010, in his Health Policy and Planning Journal, he said that systematic and financial inequalities that affect quality of healthcare, they contribute or they have a negative relationship between household economic status and the utilization of preventative services. So in that journal, he says that inequalities by economic status and ethnicity are strong determinants of healthcare services in Ecuador. So this utilization of healthcare care varies greatly by socioeconomic status, gender, age, and rural and urban residency. Another thing is there's a significant negative relationship between household economic status and the utilization of preventative and curative services. So this means that Indigenous people, as well as rural people, are much less likely to utilize these healthcare resources that Ecuador is offering. And this is a big issue. Now, I know all this information may seem daunting, especially when we talk about systematic inequalities. However, I do want to note that there's been so much improvement in Ecuador and so much reform, and there's so much that is happening. There are a multitude of nonprofits that are setting up clinics, and Ecuador has done so much reform. I just want you to sit back and I want you to think about how grateful that we are to have this type of access to quality healthcare that we do, compared to citizens in Ecuador who do not have this access to quality healthcare. So just think and just sit and think about that, really. Thank you.